Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
So we're back to, we're going to talk to Paul and then Lee, and both are talking about back pain and sciatica issues. This is Dr. Marc Darrow with my co-host, Dr. Thomas Grove, and we do regenerative medicine. We inject stem cells and platelets. We use ultrasound guidance so we can see where that needle is going, which is very, very important. And if you're getting shots like this with regenerative medicine of PRP and stem cells by docs that don't use an ultrasound, don't do it, because the solution's not going where it's supposed to go. Dr. Grove, do you remember what the percentages of injections into the knee are without ultrasound guidance that get into the joint? I think it's about 1/3 missing the spot.
Exactly. And not only do you not get it in the spot, man, those injections can be painful, right? Yeah. Again, that's a really big factor is we want to make sure these are great healing cells of the body, right? We want to deliver these on target to where we want to heal, especially when you're thinking about things like joints. You got to get that stuff into the joint space. And if you're kind of dinging up structures around it, right? I'm thinking about the knee, man, you bury that needle in the quadricep tendon. Ouch, you're going to be jumping off the table. And that's not sustainable for me because you're probably going to, I'm going to inflict some damage here. So we don't want to, we don't want to do that.
It really is beautiful watching the ultrasound too, because the patient actually on the screen can see the tissue, can see the diagnosis themselves. They can actually see torn tissue, arthritis, whatever it is. They can see it live with the joint moving or the tendons or ligaments moving. And it's a great learning experience for them. And I just love it. I mean, it's just it's almost a magical kind of experience to look inside your body to see what's going on. I just want to do a real quick recap of Paul's issues with his older sister in her mid-70s who has back pain and some sciatica, which was down both legs. Now I think it's just down one. And I just wanted to state that 90% of sciatica-type issues go away without doctors. So if you have that, don't run to the surgeon to get a surgery. I think it's a good idea to see the surgeon, but know that a lot of these things can go away. And if you're going to get a second opinion, which I tell everybody to do, no matter who I refer or what type of doctor I refer to, always go get a second opinion, at least one. But don't go to the same type of doctor because you're going to get the same type of advice.
Exactly. I literally, the case I just discussed earlier in this episode here, the individual was like, well, I've been to 6 physicians and they all told me I needed surgery. And guess what? All 6 were orthopedic surgeons, right?
So that doesn't make sense. Another thing that comes up, we have people that come in ready for their 3rd orthopedic surgery on one area. And I say to them, didn't you get it? That's not the problem. The thing they're working on wasn't the problem to begin with, because we can find the real diagnosis, the real pain generator by using our hands and doing proper examination. And I always ask after a failed surgery, did the surgeon touch your body? No. They put an MRI up or an X-ray up and showed me what needed to be done. Now, I am not here to talk down about surgeons. I am here to say these surgeries typically are not necessary. And the culture of medicine, in what I call the medical industrial complex, is medication and surgery. It's just the way it is. That's our culture. And I've been doing this work for almost 30 years, trying to change that culture to a natural method of healing by stimulating new tissue growth. Dr. Grove has been doing it for about a dozen years or so. So that's the white horse we ride on, is be safe. The first law of medicine in the Hippocratic Oath is do no harm.
Yeah, a huge factor that we're looking at with surgery is, number one, does it work? And like Doc just said, especially back surgeries and spine surgeries, the success rate is so low that maybe we should look at some other things. But really what we're looking for, how about the complication rate, Doc? Right? I mean, when you're looking at spine surgery, I mean, you could have, big bleeds, you can have big hematomas, infection risk. When you start putting hardware into body parts, right, that hardware can fail. It can get loose. You have to go back in for another surgery. You got to go under the anesthesia, which can have its own complication risk, let alone the time. If you want to commit to having, 3-4 surgeries, people complain to us all the time, well, I want it to work fast. Well, compared to surgery, this works extremely fast, right? I mean, 3-4 surgeries, you're out for a year plus minimum, right?
Well, how about one surgery? How about an ACL replacement? That's a good 9 months to a year you're out.
Exactly. So it's not only does the success rate not really make sense, but the complication rate, again, is something that you really have to take into account when you're making these big decisions. And so when we see a patient and, they've been with orthopedic surgery, those are questions I encourage them to ask. What does the recovery actually look like? Because the surgery might take an hour, but the recovery could be, over a year easily, right? And what are the likelihood that you're going to have to come back for another surgery?
It's real important, folks. If you're going to get a surgery, quiz your doctor. Do not be shy. Get the stats on what their success rate is.
And don't feel pressured when you're in a fast appointment, right? Again, I empathize with these guys. They've got to see 40, 50 patients a day. You've got maybe 5 minutes with your doc. Do not make a decision based off of feeling rushed for 5 minutes.
The other thing is bring in a pad of paper with your questions. People come and they go, oh, I hate to ask this question, Dr. Darrow. And I go, I am here for as long as you need to explain everything so you can make an informed decision whether you want to do stem cells or platelets or do nothing or go to a chiropractor or have surgery. If you want to have surgery, God bless you, go do it. But I want you educated. That's real important. So, Paul, do you have any other questions about your sister, or are you having any pain in your own body?
So fortunately, I'm 57 and I'm doing fairly well. Pretty active mountain bike rider, so I get my exercise in. I would just I kind of have a statement, and then I just want to first of all thank you both for having this kind of program, because I could tell you, as a watching my sister's situation here go on and on for years. Of course, surgery was suggested. That's pretty much been ruled out by my sister, and I would agree with her, because, as you stated, the success rate in terms of people completely healing and feeling like it was worth it is very low. And I don't base that on a study that you spoke about, but I base that on our own knowledge, talking with friends, family, coworkers that have had back surgeries that are, like you said, about half the time it works and half the time it doesn't.
And listen, when it works, it's a miracle. It's a miracle when it works. My sister had a what we're going to call a dead foot. She couldn't move her foot because of a crushed nerve, and she had a surgery, and she woke up and her foot muscles came back. So that's important too. You just have to pick the right patients. And that's why I love the surgeons. They do the hardest work in medicine. Unfortunately, in my humble opinion, there are too many surgeries that shouldn't be done that are being done. And that's the gist of that. All right, Paul, God bless you. We thank you so much.
Thank you much. And let me just say one other thing. Her treatments to this point have been to basically suppress the pain, not address the root cause, and that's why I continue to listen to your program. The regenerative part is very interesting, and I'm going to speak with her, and we'll try to get an appointment set up with you folks.
Wonderful. Is she on narcotics or something like that to suppress the pain, or gabapentin? Or
they have prescribed, I think it's Norco.
Yeah, that's a narcotic, very powerful.
Maybe some other ones, but she's a very disciplined lady. She tries very hard not to take the medicine.
Good.
But
that's smart, because
really
here's the deal:
in constant pain.
For the people taking narcotics, they are addicted. They don't know that. Okay, they're addicted, and as you take them, the pain receptors upregulate, and you need more and more of that medicine. So what I like to do when someone's on a narcotic is wean them off of it. And when I present that idea, people freak out. They go, I can't live without my narcotics.
Yeah.
And I go, just try this. We slowly wean it off. And guess what happens? A lot of their pain goes away. Sometimes all of their pain goes away once they're off their narcotics. It's very dangerous medicine. Sure, it's fine to take it once in a while, but to take it regularly is a dead end.
Yeah, very slippery slope. Chronic opioids, you're looking at things like, testosterone levels get decreased, right? Your sleep can get disrupted. Things like constipation.
It's a horrible thing.
It's a powerful tool to be used in a very acute setting. But again, the chronic use of these medications, again, just getting back to the basics, we'd rather heal that tissue, get to the root cause, get that thing addressed, and then from there, hopefully, we're not going to need to take any chronic pain meds.
By the way, Paul, we do not prescribe narcotics in our office.
We are not fans.
If someone is
well, again, doctors, I appreciate your time. The knowledge is great, and I pray that we found a solution for her. So
I hope so. Bring her in. Let's we can figure it out in 2 minutes. Really, that's all it takes, and we can tell you at that point in 2 minutes whether we think we can help her or not. And we might just say we can't help you. We tell people that.
Sure.
I'm not gonna have people getting injections.
It's better to find out the truth,
It's better to find out the truth. And, I can't remember the last time, and Dr. Grove, maybe you can comment on this too, that I actually referred someone for surgery. I can't remember.
Yeah,
I know I've done it once or twice in my career, but it just typically is not needed.
Yeah, again, but you have to have the surgical perspective and the non-surgical perspective. Really important point I want to make here too is if you're looking at, making that decision, right, make sure you're talking to somebody who's had some time in the operating room, right? Like Doc and I have spent a ton of time. I have been probably 10,000 hours in operating rooms, right? Like you have to have that perspective to know whether or not this is a good candidate. Okay, we're not saying all surgery is bad.
No,
we're just
surgeries are great for the right things.
It's just these elective procedures. There's so many of them that we don't think need to be done because we have this other option, right? Regenerative medicine, heal the tissue from the inside out.
So I'm going to, Lee, Paul, we're going to let you go. God bless you and your sister. Lee, we're going to take you next. But first, I just want to give out the phone number for other people that want to talk to us live. Dr. Grove, and I'm Dr. Marc Darrow. And the phone number to the studio is 866-870-5752. Write it down, 866-870-5752. If you want to call the office and get a free phone consult with our staff, that's 800-300-9300, 800-300-9300. They're picking up the phones now for people calling in. And I think you can really educate yourself on our website, which is prolific. It's www.jointrehab.com, and that's jointrehab.com. Every page has a spot to email Dr. Grove or myself or both of us, and there are endless videos of us doing these procedures. You can watch the procedures and see if it's something that you think would work for you. Maybe you wouldn't like it. Some people say, I'm needle phobic. I don't want a shot. Really? So you're going to get a surgery instead of a shot? Come on.
Yeah. Again, people think that if you're going to get injected, you're jumping off the table. I'm telling you, that's not the case. We were literally talking to an injector, right, Doc, this week about the size of our needles. We use really, really small needles, so no one's jumping off the table or anything like that. Very well tolerated.
Yeah,
make sure you're checking it out.
The areas can often be numbed up.
Exactly.
With a teeny little needle or numbing cream or something like that when needed. And a lot of people, I remember that woman, by the way. Yeah, she was a nurse practitioner, and she injects all day long, right?
Yep.
And then when it came time to her injection, she goes, "I'm needle phobic."
Yep, exactly.
Can you give me a Xanax? I go, "You're not going to need a Xanax."
No, and she was really concerned about that ankle injection we did. But I'm telling you, I don't think she knew I was injecting that ankle, right? As long as you're aiming where you're going, you're properly numb up that area. Guys, this is not a big deal, right? It's quick compared to something like surgery. It's not even close.
Yeah. And what are the other areas? She had her neck injected.
We did her neck, right? We did her shoulder as well, and then an ankle. Yep.
And then, this is another great case. She was thinking. She came in saying, "I have bulging discs," and they're talking about surgery. And I said, "Can I touch your neck?" So I reach over. And I touched the C3 spinous process, and she yelled and jumped. She said, "That's it. That's the spot." Mm-hmm. I go, "You're going to do surgery for that? That's on the surface. That's where a ligament is attaching to your vertebrae. It's superficial. It actually was sticking through the skin in a sense. You could feel it, right?"
Yep. And again, the look on her face was, what?
She was like,
it's got to be the disc bulge. It's got to be the disc bulge.
And I said, "No, this is something that's so easy to fix." So we got to be careful with what we do. Anyway, Lee, we're going to get to you right now. Your sciatic nerve is dead from what you say, no movement in your foot. How long have you had this foot drop, so to speak?
Your voice just went down a little bit.
Okay, I'm sorry. How long has your foot been non-functional?
It's probably been about 4 years now.
Okay. And has it been a, quote, foot drop that whole time? Where you're on
the left side.
Okay, left side, left foot, huh? And do you have back pain also?
I have back pain, but it's minor.
Okay, it's minor. So here's the deal with that, and Dr. Grove, you can comment also when I'm done. Typically, if a nerve is crunched, if that's really what the problem is, and that's the reason for your foot drop, and it's been 4 years, there's not much that can be done at that point. So how soon after this thing happened did you go to a doctor?
It was probably a year, maybe 15 months.
Okay. And did the doctor suggest surgery at that point or think it was a moot issue too late?
We went through a series of tests, and there were some delays in it that made it stretch out as long as it did. But after about 15 months of going through the foot drop, we finally did have surgery.
And the surgery did not work because it was too late?
No. My foot itself does not, I cannot move my foot from left to right, and I cannot lift it up and down.
But did the surgery do any good to help that?
No.
Okay.
They were hoping that what they did is they removed the bone spurs where it appeared it was blocking the nerve.
Okay. Was that in your low back?
That was in the L1, L2.
Okay.
Yep.
And
well, L1, L2 is not typically related to the foot, though. So I'm not sure what that's about. Dr. Grove, you want to comment on that?
Yeah, it's a little bit of a confusing story. Yeah, that's a little bit higher up than typically the nerve.
It's a lot higher up,
which is the first branch of the spinal cord that would innervate or connect to those muscles in the foot. Yeah, so when you're looking at things like muscles aren't working, you have to kind of figure out where is that problem stemming from. It could be coming from the spinal cord. It could be a root, right, or a branch off of that spinal cord. It could be more distal or further away from the back, right? So I think foot drop, also could be, condensed down or squished down, behind the knee. That's another spot as well, behind the ankle, certainly. So there's a lot of different places where it could be, bogged down. We do things like, nerve conduction studies or electromyograms looking to see, are the wires actually firing, right? Do you have a proper signal going to these muscles to activate it? So there's a couple different issues, but yeah, a surgery that high up doesn't make sense to me.
They did say they didn't go low enough.
They did say they probably did not go low enough. They feel that there was another portion that they should have touched on the L3, L4.
Yeah.
However, they said that they still didn't. Yeah,
that's more like L4, L5 is what
exactly,
we're thinking about here, S1. But, we can't look backwards, and we never comment on the work of other doctors because doctors typically know what they're doing when they're doing it. And I'm not someone to comment on what happened because I wasn't there. So I don't know if you're asking for a reason. It just doesn't make sense to Dr. Grove or I. But that's life, that's the life in medicine. And no one knows everything, unfortunately. Doctors are human beings too.
Mm-hmm.
Another question that might pop up is, would another surgery help at this point? And the answer is we don't know.
They did say that they could go through another surgery. However, they did not expect the nerve to regenerate.
Yeah, and that's been my experience when it's been 4 or 5 years of a nerve that is the problem. It's very difficult to get that back. I would go to another surgeon, though, if I were you, and get their opinion. If you've only been to one, I always get another opinion. And at this
you
point,
are my second opinion.
well, I'm not sure we're the right ones for that. It certainly would be helpful to see us, because we would probably order, as Dr. Grove mentioned, an EMG and a nerve conduction study and see if there's any action in that nerve. And if it really was coming from the back, it may have nothing to do with your back.
Mm-hmm.
You know, you think of the nerve as a wire coming from the spinal cord all the way down to your foot. You know, so that nerve theoretically is, 4 feet long or something, 3 feet long. And anywhere along that branch of the nerve can be an impingement that can cause the foot issue. And it may not be a nerve. It may be something else. I mean, you can start with us if you want to come in. You know, the phone number of the office is 800-300-9300. I think it's worth it to come visit us because we're an extra set of brains here that can troubleshoot this thing. And if nothing else, we can send you to a surgeon who we think would do a great job. And before we did that, we'd order an EMG and nerve conduction study to get a better idea of, if it is a nerve issue, where the impingement is coming from.
Yes.
Okay.
So you're suggesting I should call the office and set
I
up
think
an
it'd be a good idea in your case, yeah. And the number again is 800-300-9300 to the office. There's people there now. If they're on the phone, you can just leave your phone number and they'll call you right back. Also, I suggest you go to our website and watch some of these videos and get educated. And the website is www.jointrehab.com, jointrehab.com. And if nothing else, we'll give you a good education about what's going on with you, because that's our biggest job, is educating people. I think we spend much more time on the education part of a consult than we do anything else, because people come in with really strange ideas they've gotten from other doctors about what's going on, when it's not at all the truth. So that's it, Lee. God bless you. And we're going to send you out a free copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Okay? So, Sue, we're going to go to you. You've got a knee issue. And by the way, regenerative medicine, we've been talking about backs all day today, but it works all over the body. And as I mentioned before, I've personally injected my own knees, both of them, my own elbows, my own shoulders, my right wrist with perfect success, and other people have done my neck and back with amazing success. And Sue is calling in about her knee. So, Sue, how long has your knee bothered you for?
Well, this is the history. I had ACL surgery 4.5 years ago, and
Okay.
I had a ACL replacement with a cadaver tendon.
Okay.
And it healed pretty well. I was back to doing
Good.
pretty much everything after the surgery. Wore a
Okay.
brace when I skied. I'm pretty active. It wasn't perfect, but
Yeah.
it was doing okay. About a month and a half ago, I got into a really bad car accident.
Oh, I'm
It was
so
a
sorry.
T-bone,
Yeah.
and I went forward. My knee hit so hard on the front of the dash that it
Yeah.
actually indented the dash.
Oh, wow.
Now I'm having a lot of pain.
Okay.
I did have an MRI, and I have it here in front of me so I could read this to you.
Go ahead, do
And
that.
it
Well,
says,
I'd love
chronic
hearing that.
high-grade partial tearing of the ACL graft.
Oh, you know what you're going to have to do? The show is over. Do this. Go to the website and email me directly. I'll answer you today, and I'll call you today. It's www.jointrehab.com, and I will personally call you and answer all of your questions. God bless you, everyone, for listening to the show. The office number, if you want a free phone consult with our staff, is 800-300-9300. Thank you.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. and ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.